there are only 5 important things which you have to see in a couple, 4 in female, 1 in male. In conceiving these days for couple is delayed marriage, which we can freeze the embryo, egg and sperm.
Hello people, well, namaskara. This is Medansh and ivattu nanu Dr. Rutuja Athawale ಇವ್ರ ಜೊತೆ ಮಾತಾಡ್ತೀನಿ. Yes, she is a super fertility specialist and she's treated a lot of people, a lot of happy families are with her and ivattu ಅವ್ರ ಜೊತೆ ಮಾತಾಡೋಣ and let's have a discussion about fertility and what are the root causes of infertility and how do we treat this, how do we overcome all these ailments ಅನ್ನೋದನ್ನ ಅವ್ರ ಜೊತೆ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ. Hello doctor.
Namaste.
I have a lot of questions that commonly people ask about infertility. So you have been a specialist and congratulations, you have been doing great in the job that you're doing right now and a lot of happy people around and I just I spoken to a couple of them, quite a few people I've spoken to and they're very happy, extremely happy with the kind of service that you do, with the kind of treatments that you give. So I thought discussing with you, a lot of people will also gain a lot of knowledge. So I have few questions. Sakashtu questions ಇದೆ ನನ್ನ ಹತ್ರ. A lot of people keep asking quite common questions. ಆ questions ಬಗ್ಗೆ ನಿಮ್ಮ ಉತ್ತರ ಏನಿದೆ, ನಿಮ್ಮ ಒಂದು answers and how do we solve certain issues is what we're going to talk. Doctor, my very first question is, what is stopping couples from conceiving? What are the reasons for not conceiving?
So the most important thing which is having a hindrance in conceiving these days for couple is delayed marriage. Delay in marriage because earlier decade people used to get married between the age of 23, 25 to 30, 32 their family used to get completed. Then 5 years later by 35 everybody used to finish their family, but this generation people are choosing to marry late. They want to first achieve what they want to achieve in their careers and get married. So that is most common reason, delay in marriages. Second thing is they are looking for financial stability before taking the responsibility of the kids, so they are waiting for them to be stabilized to plan for a baby. So the women are delaying or the couple are delaying in taking the decision of trying to conceive. That is the second common reason what we are seeing in today's generation. So what happens when you delay your trying to conceive or you delay your marriages? Male, it won't affect much apart from if they have prior issues, but in female it is the biological clock or the reproductive clock which we talk about. Especially in Indian women, this clock starts ticking after the age of 35. So there is something called as ovarian reserve which is fixed for every woman when she is born, and with every passing day from her first periods or menarche, this number of eggs are going to fall only, they are never going to increase. So after 30 this reserve starts falling faster and after 35 falls even more. So because of that your AMH or the number of eggs starts falling, hence your fertility chances starts falling. This is not just about the number but also the age. As I told you, these eggs are born when the woman is born. So with a woman, her eggs also ages. So like you cannot look like sweet 16 when you are in your mid 30s, your eggs also will not be looking like sweet 16 years old when you are actually 35 years old. So the aged oocyte, when you use by any means of conception, whether it is natural or whether it is through IVF techniques, the egg will be the same. So the DNA will be degenerated. So as the aged oocyte is used to form the embryos, the quality of the embryos get affected and the risk of genetical abnormalities, abortions, no embryo formations, upung or anomalous babies and problem in conception starts increasing. So this is first most common thing, that is delay in marriages and delay in trying to conceive. Second most common thing which we are seeing in today's generation is lifestyle issues. People are working, both partners are having very tedious, hectic work lives. So work-life balance is the second issue which we are seeing in today's couples, in which they don't have time to spend with each other. So the correct timing for a couple who is newly married or planning for a conception is not able to fall at place. Third important thing is stress, whether it is work related stress, whether it is financial related stress or relationship related stress, which also add on to the fertility issues in a couple. And last but not the least is the lifestyle issues like alcoholism. Smoking is on a rise, not just in male, but nowadays females are also smoking a lot, and smoking affects fertility, fertilization, embryo formation, conception, and even in the baby weights of the babies. So that is the last reason, which is lifestyle issues like smoking, alcoholism, and then drugs. And apart from that, very sedentary lifestyle. Along with this, we are the world capital of diabetes, so diabetes is on a rise, hypertension is on a rise. So as you delay your conceptions, as you delay your chances of getting married later, it will lead to different kind of issues like you develop diabetes, hypertension, lifestyle issues, sedentary lifestyle, weight gain, obesity. All this also add on to the conception issues.
Can lifestyle changes of the couple help them conceive?
Lifestyle changes definitely will help a couple to conceive, or at least aid your conception journey, because if you're obese and if you lose 5 to 10% of your body weight, definitely your complications of fertility and pregnancy are going to go down. Your response to every drug will improve. So definitely lifestyle helps in aiding your fertility journey, like you quit smoking, decrease your alcohol intake, improve your sedentary lifestyle, become little active, do de-stressing activities like meditation, pranayama, and have a well balanced healthy diet. If you're obese, lose weight. If you're having diabetes, control your diabetes. If you have hypothyroidism, control your hypothyroidism. This all lifestyle related issues, if you correct it, definitely it will be making your fertility journey more smoother. And not just fertility, even if you conceive naturally with lifestyle changes, it can improve your pregnancy journey also in a better way.
While they undergo this fertility treatment, what are the possibilities of having twins?
Possibility of having multiple pregnancies in IVF techniques are little high, especially when you do blastocyst culture and you do a pre-genetic screening of the embryos. Then you can go for single embryo transfers. So when you go for single embryo transfer with laser assisted hatching, the risk of having twins is almost around 5%. But when you are not doing pre-genetic screening and you are doing embryo transfer with 2 or 3 embryos or blastocysts, the chances of twin pregnancy is 35%, triplets is 5%, and quadruplets can be almost 0.5%. Yes, there are many treatment options available today in 2024 which were not available in prior decade. Like we have from IUI to donor sperm IUIs to IVF to ICSI or ICSI technique to spindle ICSI techniques. We now even have embryo labs. We also have ERA. We also have blastocyst cultures. We also have pre-genetic testings. We have non-invasive pre-genetic testings, and we also have surrogacy options available now. We also have donor egg programs available now for people who don't have egg or sperm, or who are not having who are having genetical issues in their genes and they want to have healthy procreations. We have those all things. So there are multiple options available today, but we have to individualize who needs what. Like you are just 1 year married and you're looking for a pregnancy, first evaluation and defining the cause of infertility is more important rather than what technique I'm going to give. So individualization, and then planning properly what will be your plan A, what will be your plan B, and what will be your plan C in your fertility journey. Because success is not just getting beta HCG positive, success is getting a healthy, genetically normal baby in hand. So it has to be individualized and it has to be curated according to patient, defining where is the problem and what can be the solution.
Rather, what are the success rate of the fertility treatment that one undergoes? What are the possibilities?
Coming to success rate of treatment, if you have diagnosed yourself correctly and you have planned your fertility journey in a right way, if you are doing IUI, the indication for IUI should be where female is absolutely normal, her fallopian tubes are open, her ovarian reserve is correct, her eggs are ovulating on time, then you can do a IUI or intrauterine insemination, in which we collect the husband's sample. If it has a low sperm count or if it has a low motility or less morphological forms, but not as low as it is single digit number, but it is moderately less, then we can take these sperms, process it in the incubator and a centrifuge machine, and take these sperms and inject into the uterine cavity of the female when the ovulation happens. By this procedure, the success rate is almost 12 to 15%. That means when I do IUI of 100 women, 12 to 16 women can conceive in one go. The success rate of IUI is same worldwide since the day it was being invented, because it works on anticipation that a follicle has ruptured, it has released an egg, tubes are open, means they are functional. If I have pushed the sperms in the uterus, they have to travel only 1/3 distance till fallopian tube, but they are going or not, egg is being fertilized or not, embryo is growing till 5 days or not, and it is able to implant or not, we don't know. So it works on a lot of anticipation. That's why success rate is only 12 to 15%. Coming to IVF or ICSI, intracytoplasmic sperm injection, if you go for IVF method, if your oocyte quality is good, if your sperm quality is fine, and if you have a good embryologist who has a good experience, and you have a world-class ICMR guideline embryology lab, and if you grow an embryo till day 5 and you get at least 2 embryos of good grade or at least 1 PGS normal grade 1 embryo, and you do an embryo transfer in an ideal good lined uterus, the success rate can be varying between 70 to 80%. But if the quality of embryos are low, or the uterine lining is not great, or your ovarian reserve is also low, the quality of egg is low, or the age of the mother's oocyte is more, then the success rate may vary from 40 to 50% if embryo quality is not good.
Okay, one more important question. So, do we have any side effects of the fertility treatment? Does the couple or either of them get any kind of side effects on the fertility treatment that they undergo?
The only side effect of fertility treatment is a lot of injections. The female has to be mentally prepared for multiple injections during ovarian stimulation and after embryo transfer. Why? Because we have to give these injections to grow the eggs. So during that time, women has to take 2 to 3 injections every day for almost 10 days. Apart from that, there are no other major complications, but yes, you are undergoing anesthesia, so there can be little anesthesia issues which are rarely seen, maybe in 1 to 2% of the people. And the most dreadful complication which was seen in fertility in earlier decades was ovarian hyperstimulation syndrome, that is OHSS, which is not seen in today's generation or today's era, because we all use antagonist cycles, we don't use agonist cycles, we all use decapeptyl triggers, which prevents OHSS completely, and now we all have OHSS free clinics in majority of the centers in India.
Do you offer embryo preservation?
Yes, majority of a well set lab or embryology labs will have fertility preservation room or cryopreservation room, in which we can freeze the embryo, egg and sperm. All can be frozen. Once we freeze the embryo, it can be frozen lifelong. You just have to maintain the temperatures of the cryo tank. Embryologist has to monitor that they are well preserved. Every monthly and weekly they have to check the tanks are full, and you can preserve the embryos for as long as time as you want. Nothing will happen to the embryos. Egg freezing is also very easy and it is very comfortable. Only thing is, when you do egg freezing, the survivability of eggs is only 70% as compared to embryo survivability. Embryos can survive 100%. So if you freeze 10 embryos, all 10 embryos will survive freezing. But if you freeze 10 oocytes, out of that 7 to 8 will survive, 2 to 3 may not survive the freezing and thawing process. Coming to sperms, sperm can be easily frozen and can be used later for any other use. So it is the most easily freezable gamete available.
As you mentioned, there are a lot of fertility treatment that one can undergo. So, what are the various ways of getting the fertility treatment for the couple? What are the different ways in which what are the apt treatments for these fertility?
Yes, infertility diagnosis is very important because every couple the issue will be different. So which couple is suffering from exactly what issue has to be diagnosed. But before diagnosis come awareness. Lot of couples are not aware of what are the correct investigations which has to be done before planning for how you are going to go ahead with your treatment options. Like sitting in the fertility clinic, we get couples coming to us in the fag end when nothing else works. So first, if any couple is not conceiving, they will first go to the nearby family doctor. They will give some treatment. Who has little bit limited knowledge, he'll try to evaluate with that and try to give some treatment. If that does not work, they will go to a nearby gynecologist or family gynecologist who is not specialized in fertility treatments. Then she will try her hand. Or sometimes some people go to Ayurveda, they go to homeopathy. Then some people are also into blind beliefs of going to Guruji, doing certain Ayurvedic yoga treatments, panchakarma, acupressure, mannat. Lot of beliefs are there. Log mannat mangte hain, and lot of people go into upasas and they will follow certain rituals, get lot of puja done. After everything, when nothing works, then they come to us. So lack of awareness is the most important cause. First, be aware. To be aware that there is a problem, you need to accept there is an issue in you. So first come awareness. After awareness, you'll realize there is a problem. Then you will look for solutions. Then you will look into the diagnosis, where is the problem, and then comes the planning of fertility, how to plan further. So that is the main issue. Now coming to diagnosis, how to diagnose. So the diagnosis is not a rocket science. It is a very simple thing. There are only 5 important things which you have to see in a couple. 4 in female, 1 in male. What are the 4 important things which we have to see in female? First and foremost thing is the uterus, because uterus is home for baby for 9 months. If home is not good, where the baby will stay? So uterus should not have any congenital anomaly, uterus lining should be good, blood supply should be fine, and it should not have any abnormal growths like uterine polyp, endometrial submucosal fibroids, or endometriosis or adenomyosis. Second important thing what you have to see is the fallopian tube. Fallopian tube is the most important thing, because if fallopian tube is open, then only egg and sperm will meet, then only embryo will form, and then only this embryo will come to the uterus and give us a baby in hand. So if fallopian tubes are closed, then egg and sperm will never ever meet. That is why the Louis Brown, who is the first IVF test tube baby born in 1978, her mother's tubes were blocked. That is when scientists thought that we will take out the egg, we will take the sperm, try to make them meet outside and drop into the uterus, and that is how Louis Brown was born. So Louis Brown's mother's tubes were blocked. That is when the IVF was discovered. So second is fallopian tube should be open and it should be functional. Third investigation which you have to see is the ovarian count or your egg reserve. How to check this reserve? By a hormone test called serum AMH, which will give you an idea how many eggs are available for your fertility from today onwards. So if egg count is too much, which is called as PCOD, is also problematic, and egg count too low, where your fertility reserves are very low, again is a problematic situation. Fourth important investigation what you have to see is all your hormones which dominates your complete ovarian axis should be normal. These are the only 4 tests which we have to see in female. Coming to male, there is only one test which is most important, that is semen analysis. In semen analysis, we have to see count, we have to see motility, and we have to see normal morphology of the sperm. If there is count is less, it has an issue in conception. If the motility is less, sperms can never reach the fallopian tube, so it can never meet the egg to form a baby. And if morphological forms of sperms are not normal, it won't be able to be fertilized by an egg to give us a baby in hand. Apart from that, certain health related basic health checkups every couple should do, which include sugar, thyroid, diabetes, and obesity, and lifestyle changes. So preparing a couple for a infertility treatment, as I always say, first thing is having a good knowledge how a natural conception happens, what are the problems which can come in a natural conception, and what actual problem they are suffering from. Once they are aware of it and they accept that there is a problem, then only they will look for solutions. Once you look for solutions, then you make your journey plan A, plan B, plan C, and follow it accordingly. So in this, when you are planning your fertility journey, you also have to plan your work-life balance. You also have to plan that you have to take out time. Female will be needed more, male will be needed less. Male is needed only 2 times technically, once for seeing the sperm count and all the other evaluations and giving them treatment accordingly, and second time when we do a egg pickup to form the embryos if we are doing a IVF, or while doing a IUI if we are doing IUI, we need husband sperms when we call them for. But women is needed multiple times in a month, so she has to plan her work accordingly. She has to dedicate time to come to the fertility clinic, so she has to adjust her work life balance. Second thing is lifestyle balance. Lifestyle, if you are obese, you should start working out. If you are diabetic, you should control your sugars. If you are hypertensive, you have to control your BP. If you are hypothyroid, you should correct your thyroid levels. If you are having stress, you should work on your stress levels. You should have a little active and not a sedentary life. Start working out or going to a Zumba class, whichever gives you relaxation or meditation, and then come to and talk to your fertility expert. Make a proper plan which is realistic and practical, which will give you a successful baby in hand. Thank you so much for having me. It was pleasure talking and sharing my knowledge with everyone. I hope it comes useful to some of the couples watching it. Thank you. Anybody wants to contact me, I am freely available on Instagram. You can ping me there. Otherwise, you can see me in Jayanagar. We have a full-fledged IVF clinic by name of Parency IVF Hospital in Jayanagar 5th block. We are also available in Electronic City on Niladri Road. You can contact me there also. Apart from that, you can ping me on LinkedIn or Facebook also. Thank you.